When sugars from the food you eat are not cleaned away, plaque can form. When plaque remains on your teeth, acid is then produced, which can eat away at your teeth, making little holes. This process is called tooth decay. In this example, you can see that the decay has been detected early. It is through the tooth's enamel and into the dentin layer, but not all the way to the pulp chamber. For this slight amount of decay, a filling can be used to restore your tooth. The first step is to remove the decay from the tooth. Material is then placed in your tooth to fill the hole. Filling material can be made of a variety of materials such as silver amalgam or white resin. To complete your restoration, the filling is then smoothed so that it feels natural in your mouth. After your filling is in place, you can reduce your risk of further tooth decay by properly brushing and flossing your teeth every day.